Good morning and welcome to Boston Outlook. I'm your host, Julee Marra. On the line with us this morning is Dr. Philip Stieg. He's a world-renowned neurosurgeon. Welcome to the show.
Thank you so much for having me, Julie.
I'm excited to have you. This is very timely because, as many of us know, Tom Brady's wife, Gisele, just kind of dropped a bomb on everybody saying that Tom Brady had suffered concussions last season. And that statement, I guess, has kind of been turned around by the NFL and his agents and saying that he did not suffer from concussion. But this has definitely been a topic that is on everybody's mind, and it seems to surface every couple of months, every couple of weeks. So, I mean, you're the expert, so where do we even begin with this?
Well, concussion's a difficult thing to, number one, diagnose, and I'm a little bit surprised by those comments. Basically, the player or any individual has to suffer from a temporary physiologic loss of function of the brain. And certainly in the NFL now, working as a sideline consultant, we are very sensitive to watching the mechanism of potential injury, and then if there's a question, the player is brought to the sideline and quickly evaluated for the risk of a concussion.
Mm. So, I mean, to hear that statement, obviously, there's so many questions of, well, if it even did happen, how come he was continuously put back into the game, right?
Exactly. So, again, I think that there's, like a lot of things in the news these days, there seems to be a lot of conversation, but we would have to have some specifics where we could go back, and if we said that there was a particular time when he had a concussion, we could watch the replay and then ask the question, why wasn't he evaluated at that time, if it truly did occur?
Right. So, I mean, concussion, like I actually just said to, my husband the other night that I've heard the word, but I didn't really know exactly what it was. I knew that it was a head injury, but I think it's a little bit more specific than just that broad statement.
It's specific, but it's also broad. The diagnosis is basically, at this time, clinical, meaning, again, that the patient has, or the athlete has a sudden alteration in the physiologic function of their brain. If we take them and got a CAT scan or an MRI scan immediately, there isn't an injury that we can see. There isn't a blood test that we can do right now. So it's a clinical assessment where we have a specific set of questions that we ask players or patients, and certainly in the professional arena, pre-season, they all take this test called an impact test, and then post-concussion or post-possible concussion, they redo the impact test.
And what does that test entail?
It's a lot of factors. It takes the players about 20 minutes. It asks questions that assess orientation, eye-hand coordination, motor skills. And there's a baseline score that one has, and then we assess whether there's been a change in their baseline.
Okay. So, I mean, is this something that, like, if you did get some sort of blow to the head or, some sort of violent, incident to the head that, maybe didn't necessarily pose that it was a concussion, but maybe like later on, does it come up?
Yes. There really is kind of almost an epidemic of concussion if you think about it. The estimates are that somewhere between 1.5 and 3.5 million concussions occur on an annualized basis.
Wow.
And the vast majority of them don't even come to an emergency room.
Why?
So,
is it because they don't know that they have one, or they're not even experiencing the symptoms?
Right. They initially don't know that they had a concussion. And you have to remember that a concussion isn't necessarily a direct blow to the head, but it can also be related to a violent shaking motion. For example, you get rear-ended in your car and your head snaps forward and back. You don't lose consciousness, but you have to remember that your brain is suspended in water within your skull. And so with that rapid forward and reverse motion, your brain can hit the inner portion of your skull and cause a concussion. You may not lose consciousness, but then you could start having the symptoms of a concussion later that day or the next day.
I know. I always hear that, like, if you do get into an accident, you should probably seek medical attention, even if you don't present symptoms because of what you just said.
I don't disagree. I think I wouldn't want to see everybody with a minor fender bender running to emergency rooms right now, because then the emergency rooms would be overwhelmed. You have to use clinical judgment. If it was a severe accident, yes, a person should be clinically evaluated.
Yeah, definitely. So what are some of the symptoms that, may present, and are they different for children versus adults?
Children are more susceptible to concussions than adults are, and surprisingly, professional athletes are less susceptible to concussions than adults, presumably related to training. The symptoms that one can have are varied. It can be mood changes, headache, difficulty with concentration, light sensitivity, difficulty with sleep, loss of appetite, irritability, and just a general headachy, malaise, lethargic kind of feeling.
So once those symptoms present, do you call the doctor? Do you go to the emergency room? Call an ambulance?
What I would recommend, again, it depends upon the severity of the symptoms. If you have a severe headache, I would go to the emergency room right away. If it's more of a chronic low-level headache and you're finding that you're having difficulty with sleeping, I would contact your doctor, or if you're in a major medical center like here in New York, somebody can call the Weill Cornell Concussion Center, and you can get information, get an appointment with physicians that specialize in the management of concussion. We're still going through a fairly aggressive educational process for even physicians, because concussion has become a much more prominent healthcare issue than it was thought to be in the past.
Yeah, I didn't even think about that end. I mean, so this is kind of something that is evolving as time goes on, and you guys must be learning more and more that, we're kind of the guinea pigs, so to speak.
Well, I wouldn't say it's guinea pigs. I would say that it's an evolving science, like the treatment of any other disease. Several years ago, we would recommend to a patient that's had a severe concussion to basically stay calm, don't expose yourself to a lot of sunlight, and remain in dark rooms. We don't do that anymore. Obviously, if bright sunlight bothers you, you avoid that, but we recommend that a patient tries to remain at least baseline activity, and then start to sort out what bothers them. Say they look at the computer screen and they get headache and eye pain. Well, then you shouldn't do that, but that's a test down the road to determine whether you're recovering from your concussion.
Is it best to kind of track what, may bother a patient if they are posed with some of those challenges during the recovery process?
Absolutely. What we do is we ask patients to keep a track record, write it down, what seems to bother them. We can try to help them. Say they have sleep irregularities, we can give them something. If they have some appetite issues, we can give them something. In patients that have severe concussions, at about 3 months, we will do formal neuropsychological assessments, and then at times we can help them with what's called cognitive remediation.
And I mean, what is, like, each person must be different in their recovery process and time, right?
Most concussions resolve within 7 days. When we're talking about the neuropsychological testing and cognitive remediation, those are the rare but severe forms of concussion.
Okay. And long-term effects, what are we thinking about that?
I've seen patients, or I have patients, that have had their concussion symptoms for up to a year. But one of my patients actually has written about it, and she came back and won a Pulitzer Prize. So
wow.
you will recover.
It's just how long, and like I said, everybody is different, so there probably is no magic formula, but you could expect to maybe start seeing it to turn around after a week's time or so.
Agree totally, and that's one of the problems with being a physician in America. We're all used to turning on the TV and getting instant gratification.
Yeah.
And what we have to do with this patient population is continuously reassure them that they are going to get better, but their body heals at their particular rate, and we don't have the magic pill to make it go away.
Right. And you're right, because I mean, everybody has phones and computers and internet access, and I'm sure that everybody just Googles whatever their symptoms are, and they try to almost get information before they call the doctor, which must make it worse for you guys because it's probably creating more anxiety from the patients.
Exactly. Anxiety is one of the bigger things we have to deal with. It's good and bad. I think that it's important that patients understand. On the flip side of it, sometimes the patients try to be the doctor as well as the patient,
Yeah.
and that can create problems.
Totally. So you have a pretty lengthy resume. I mean, I only have a couple of bullet points that I wrote down here, but I mean, kind of give us the rundown of what even brought you into the field of neurosurgery.
Well, I originally got my PhD in neurosciences, and much of my research during that time was focused on acute cerebral trauma, looking at the mechanisms of injury to the nerve cells and to the surrounding cells of the brain. So it was kind of a natural fit for me once I got done with my PhD to go on into medicine, and I found that I had a natural proclivity for the neurologic system, so it just kind of happened.
A natural fit, right? And then everything
Yeah.
else just kind of came with time.
That's how I advise my medical students. Find something that you're naturally good at and find something that you love. That way it'll work, and it won't be a struggle for the rest of your life.
Yeah, because I mean, you don't really hear of doctors making career changes, so to speak, right?
Right. It's number one, you have to do something that you love. But number two, the important thing about medicine is that it is not only a science, but it's an art form. And with more experience, you get to be a better artist.
That is true. That is true. And it's a big time commitment, too. I mean, it just doesn't happen in the typical 4 to 5 year path that, most other professions kind of follow.
Yeah, there's 4 years of college, 4 years of medical school, and then for neurosurgery, there's 7 years of neurosurgical training, and some individuals will do an additional year of fellowship training. So you're talking about 8 years. By the time you're done, you're 34 years old.
Yeah. Wow. And that's when most people...
All of your friends have made a fortune in the hedge funds.
Right, exactly. That's the thing I was going to say. And like, you kind of feel settled once you turn that corner of, into your 30s, and you feel like, all right, like I've done what I needed to do to get me into that spot. But you guys are just starting at that point.
Exactly.
Now, you're also the president of the Brain Tumor Foundation. So what work have you been doing in New York City to kind of, educate the public and raise awareness and research?
The Brain Tumor Foundation is based on the principle that early detection is in the patient's best interest. So what we've been able to do is we raise the funds to purchase a mobile MRI scan, and then we transport that MRI scanner around the country. It's been in Boston, Las Vegas, New York, for example, and we basically park it in a major busy street in those cities, and then individuals can come in and we get an MRI scan. If there is a finding on the MRI scan, the patient is notified immediately to contact their primary care physician and seek medical attention. What we're trying to determine is the utility of getting an MRI scan for brain disease. Now, obviously, we're not only finding brain tumors, we're finding other abnormalities in the brain, which are important for the patient to know about.
Seems so
We're
scary.
currently putting together the statistics around that data that we've been acquiring.
I mean, so this is literally people are just kind of in the area of where this mobile scan station is and
Yep.
just are walking in. So, like, they're going about their normal everyday business and then they just swing on in for an MRI.
Right.
Wow.
Yeah. It's for the person that's curious. Obviously the question is, are we attracting the person that hasn't gone to the doctor, but they've had some symptoms, which from a statistical standpoint could be biasing the patient pool that we're looking at. But I think the other important thing to know is that there are new portable MR technologies becoming available that will make it easier and less expensive to obtain an MRI scan, in which case we will start picking up diseases earlier. And obviously with that, we can then practice more preventive medicine.
Yeah. I mean, are there some diseases or, abnormalities that may present themselves without any symptoms that, people wouldn't necessarily call for an appointment to get a scan?
Certainly. I mean, there are benign brain tumors and there are low-grade malignant brain tumors that we can pick up on the MRI scan, and the earlier you get them or identify them, the easier they are to manage. Patients with aneurysms, which are basically blisters on a blood vessel, we can pick them up, not real well with a scanning MRI scan, but we can pick them up, and that's the type of problem that you're fine today and the next moment you can drop over and die.
Right. Right, and that's scary. And aneurysms don't necessarily have to affect the brain, am I correct?
Well, when they rupture, they do.
Okay.
Once an aneurysm ruptures, the general term for that is called a stroke, and the specific type of rupture is that it bleeds around the brain. And it's 40% of people that experience that won't survive.
Wow.
So it's obviously something nice to pick up early.
Yeah, totally. My gosh. So do you recommend that people bring this topic up at their next physical? Or, is it something that's more specific to those who maybe have a family history or the symptoms?
I have to be careful what I say. Many of my medical associates would be mad at me if I was an advocate for everybody getting a brain MRI scan. Certainly the insurance companies wouldn't like
Right,
that.
yeah.
From a healthcare policy standpoint, that would be expensive. That being said, I think that patients that do have prolonged, ongoing brain headache, neurologic symptoms should probably undergo an MRI scan. There are many instances where I see patients that have had symptoms for years and somebody finally ordered an MRI scan. I wish they had gotten it much earlier.
Wow. Yeah. I always say this too. You've got to be your own advocate. So if you think that there's something that's presenting and isn't right and it's not right, you've got to keep pushing until you get those answers that you're looking for.
I agree. And in this day and age, I think you can find a doctor that will be your advocate as well.
Absolutely. Absolutely. We've been chatting with Dr. Philip Stieg. He's a world-renowned neurosurgeon. We've talked about concussion, the risk factors, symptoms, treatment, recovery, etc. And, we've talked about your resume and what you have done to raise the awareness of brain injury and brain tumors and concussions and so forth. Is there anything else that you wanted to make sure that we talk about?
I think that one thing we probably should mention is that in the youth athletic field, moms and dads should be really involved in monitoring what's going on with their children. Many times a coach might be at practice or at a game and they don't see a hit that goes on in a game, and the parents have to call attention to that. In addition to that, I think that a comment should be made about concussion in women and in young girls. It seems to be more frequent in young girls and women. One of the factors might be that women are more likely to report a concussion than men and boys are. And another factor is that young girls don't have the neck mass that a young boy does, and they experience more of the shaking type of concussion rather than the direct blow type of concussion.
That's interesting. I see. if we didn't have this conversation, I would think that it would be the opposite statistic.
Yeah, yeah. Concussion is becoming a real problem in sports. It has been in soccer, field hockey. Obviously, we see it in regular hockey and football. I've had children wearing a helmet, but they get hit in the head with a baseball pitch, and they have severe concussions.
Yeah. Do you think it's because there's just more information that we have at our fingertips that those statistics are that much higher than they were years ago?
No, I think there's real physiologic reasons. You know, you're young, your brain is developing, it isn't as resilient. And as I said, in women, it's because of the neck musculature just doesn't protect them as well.
Well, I think that pretty much covers a lot of ground here. Anything else before I let you go?
I think that covers it all.
All right. Well, thank you so much for your time. I know that it's been probably a busy week and weekend for you, so thank you for taking time out this morning to come on to Boston Outlook, Dr. Philip Stieg.
Julie, it's been a pleasure. Thank you so much.